Well, I think initially it's going to be used in the relapse setting for elotuzumab, where it was best studied, and in the refractory setting for daratumumab, where its hopefully registration-enabling study will fit as well. But my guess is that these are going to be applied across the spectrum of patients. We're going to start treating patients at the front end with antibodies, maybe different antibodies at induction from what we use in maintenance or consolidation. But I think one or two antibodies is going to be a feature of what we do across the spectrum of treatment, just like what we do with rituximab in lymphoma. You see, rituximab is used everywhere. I think the advantage we have in myeloma now, that our patients have in myeloma, is that we don't just have one, we have two, and they're different targets, and that's really exciting. For older, frailer patients, the endpoints that we want to achieve are the same. Try and get them to complete remission, or even MRD negative complete remission if we can. That's harder to do in a frailer patient because of the toxicities of treatment. What antibodies really bring to us is a way to get at the tumor with very little collateral damage. And I think that's a really unique feature. The only thing you really see with the antibodies is infusion reactions, and that occurs in the first dose. Beyond that, it's pretty much gone. So I think the long-term side effects are really going to enable us to push the barriers of response for older, frailer patients. There's about 10 to 15% of patients at diagnosis who at 15-year follow-up are still in ongoing remission. So I would argue that those patients we're already curing now, and that's old data with old drugs from the Spanish group. My guess is that with the addition of some of these targets like antibodies, with understanding some of the mutations that we see in myeloma, RAS, RAF, MAP kinase, BRAF, IDH1, IDH2, that's going to help us to increase that cure fraction in the next 5 to 10 years. And my hopes are we can double it.